Life after stroke. Hope and help. You've had a stroke or a TIA. You, your family, and friends have questions and concerns. It can be overwhelming in the beginning. This DVD is designed to help. My name is Mary Pinzon. I'm a stroke education nurse, and my own family has been affected by stroke. When you understand stroke and what causes it, you improve your chance of recovery, improving your lifestyle as a survivor, and avoiding another stroke. I've prepared this DVD with the help of many friends dedicated to increasing stroke awareness and helping stroke survivors to move forward and maximize their lives. Over the past 15 years, progress made in helping to treat stroke survivors and prevent recurrent stroke has made all the difference in the world for millions of Americans. This DVD is going to give you a lot of answers. It is set up in chapters so you can play the ones most important to you a chapter at a time. Then return later to view more. However, I strongly encourage you to watch each chapter. For stroke survivors and their families, knowledge is power. Life after stroke is a message of hope and help. It can be very challenging, but you don't have to do it all by yourself. This information is designed to provide practical, usable tools that can improve life after stroke for you and your family. What is a stroke? Most people know a heart attack is the result of a loss of blood flow to the heart. Similarly, a stroke occurs when a blood vessel in the brain is suddenly blocked or bursts. A stroke, in short, is a brain attack. When a stroke occurs, part of the brain cannot get the blood and oxygen it needs, so it starts to die very quickly. How a stroke affects a person depends on the part of the brain in which the injury occurs and how fast blood flow is restored to the brain. Most patients don't report to the emergency department until 12 to 24 hours after the onset of stroke symptoms, which increases the damage stroke can do and lessens achievable recovery. That's why every minute matters in getting treated for a stroke. Let's start by knowing how to recognize one. What are the most common warning signs of a stroke? For those who've already suffered a stroke, or for those who've never had a stroke, the warning signs are all the same. There are 5 key warning signs of a stroke, and all 5 warning signs have one thing in common. They occur suddenly. Let's review these key warning signals from the top of the head on down. Number 1, sudden severe headache with no known cause, the worst headache of your life. Number 2, sudden trouble seeing out of one or both eyes. You may only see half the world, or a quarter of the world is missing. Number 3, sudden trouble talking or understanding what is being said to you. Speech may sound slurred, garbled, or the wrong words come out. You may have no speech at all. Number 4, sudden one-sided weakness, numbness, or paralysis. Could be just your hand, the arm, the leg, the foot, or could be multiple areas. And number 5, sudden loss of balance, coordination, or confusion. Remember, it only takes one of these symptoms, and although there may be more than one. If you think it could be a stroke, act fast. In fact, the word fast may be the most important word you know when it comes to the signs of a stroke. FAST is the main word to remember because the letters stand for the 3 most common signs or symptoms of a stroke. Oklahoma has created a statewide campaign called Stroke Heroes Act Fast. Let's watch.
Jenny and a grandma made on an ordinary day. When there in the kitchen, Grandma started to sway. Grandma sounded strange when she spoke, and Jenny had to ask, what if my grandma's having a stroke? I think I better act fast. I think I better act fast. Does her face look a little bit uneven? Does one arm drift down? Is her speech coming out kind of strangely? Then it's time to call 911. in town. When Hank looked up, half his face drooped down. Hank wasn't making a joke, and so Jack had to ask, what if my buddy's having a stroke? I think I better act fast. I think I better act fast. Does his face look a little bit uneven? Does one arm drift down? Is his speech coming out kinda strangely? Then it's time to call 911. Helen and Bob were walking at their favorite time of day. Helen turned to Bob and said, my arm is not okay. Her arm was limp inside her coat, and so Bob had to ask, what if Helen is having a stroke? I think I better act fast. I think I better act fast. Does her face look a little bit uneven? Does one arm drift down? Is his speech coming out kinda strangely? Then it's time to call 911. Stroke can happen anywhere, morning, noon, or night. And every minute after that, more brain cells die. Our heroes acted quickly, and so they all have hope. Precious time and emergency care. You can beat a stroke. You can beat a stroke. Call fast for any sign of stroke. It's what you gotta do. Call fast, call 911. The one you love is depending on you. Someone's depending on you. Someone's depending on you. Someone's depending on you.
Now let's review. The letter F stands for face. Ask the person to smile a big toothy smile. If one side of the face droops down, think stroke. The letter A stands for arms. Ask the person to hold out both arms in front of them. If one arm or just the hand begins to drift down or can't be raised, this is one-sided weakness. Think stroke. The letter S stands for speech. Ask the person to say a short sentence like, the sky is blue today. If it comes back slurred, garbled, wrong words, or no response at all, think stroke. If even one of these symptoms happen, then the letter T stands for time to call 911. Now. Don't waste time calling to your doctor, your husband, your wife, your mother, father, neighbor, your friend, anyone else. Just call 911. Don't try to drive yourself to the hospital. Just call 911 so the hospital ER will know you're coming and will be ready to take care of you. There are two types of stroke, ischemic and hemorrhagic. Now let's look at each type. The first is ischemic. 85% of all strokes that happen are ischemic, also known as a blockage stroke. It's a sudden loss of blood supply to an area of the brain that controls a specific function, caused either by a blood clot that forms in a blood vessel in the brain or by a blood clot that formed elsewhere in the body and travels through the bloodstream to the brain. If this clot becomes stuck in a blood vessel in the brain, a stroke can result. A hemorrhagic stroke, also known as a bleeding stroke, is caused when a blood vessel breaks and bleeds into the brain. Hemorrhagic strokes account for the remaining 15% of all strokes. In addition to ischemic and hemorrhagic strokes, some people experience a brief warning that a major stroke may happen soon. This is called a transient ischemic attack, or a TIA. Sometimes called mini strokes, TIAs have the same cause and the same symptoms as the ischemic stroke, but go away in under an hour because the blockage can break up or dissolve enough to restore blood flow to the brain. The symptoms usually go away without permanent damage, but persons who have a TIA are 10 to 15% more likely to go on and have the major stroke in the first 90 days if it's ignored, and half of those may occur in the first 48 hours if not treated immediately. TIAs are an extremely important warning sign of stroke and should never be ignored. Get to the hospital now. A few key facts about stroke. Strokes can be prevented. Over 750,000 Americans suffer from a stroke each year. That's a stroke every 45 seconds. However, 200,000 of these are recurrent strokes in a person who's already experienced one stroke. There are over 4 million stroke survivors in the United States today. Although stroke is the third leading cause of death in the United States, it is the leading cause of adult disability in this country. What are the effects of a stroke? The effects of a stroke depend upon a number of factors, including the location of the blockage or bleeding and the extent of brain tissue affected. The way the brain is connected, one side controls the opposite side of the body. If a stroke happens on the left side of the brain, the right side of the body and the face could be affected, producing any or all of the following: weakness or paralysis on the right side of the body, speech and language problems, memory loss. Now, if the stroke occurs on the right side of the brain, the left side of the body and face could be affected, which could produce any or all of the following: weakness or paralysis on the left side of the body and lost or blurred vision.